Good afternoon, everybody. Welcome back to the last session of the day. We've got some great speakers lined up for this last part of the day. Our first speaker is Kathryn Taylor, who's a paediatric renal social worker, and she'll be talking about the psychosocial aspects of kidney care and multidisciplinary working. So, welcome, Kathryn.
Waiting for my presentation. Oh, I need to do it. Oh, okay, that's a great start. I didn't recognise that front page and I was like, oh, this is interesting. I'm not sure what happens here. So, okay, well, let's see then. There we go, look at that, right. So good afternoon, everybody, and thank you to the NKF for inviting me to speak today. I'm Kathryn, and I'm the specialist social worker in the kidney team at Bristol Children's Hospital. So today I'm going to talk to you about psychosocial aspects and multidisciplinary working within my team and how this supports the child and their family. So, for those of you who know your geography, Bristol is in the southwest, and this map shows the region we cover. This is quite significant, actually, when you think about the map, looking at the southwest, and if you are living in, the southernest point of Cornwall, and your care is then could be 3-4 hours north up in Bristol, and that always gives me a moment to think about that sometimes when I'm meeting our families and we have our patients coming in for appointments or perhaps coming for dialysis or transplant. There's also a picture here on World Kidney Day of some of my team, and we're all dressed in yellow, and I've got kind of centre point there holding up a picture in the front row. And then the other diagram there is showing kind of the core team that I work with, and there's also a picture of the Children's Hospital if you have never been to Bristol or ever seen it before. So, a little bit about me. I've been working in the team for 6 years now, but I've actually been working with children and families in a variety of different roles for over 25 years. Very kind of tongue-in-cheek picture there. I don't think by any means I'm Mary Poppins, but I also don't think I'm Miss Hannigan either. So perhaps I'm kind of somewhere in the middle. I mean, my children might disagree with the Miss Hannigan bit at times. But yeah, I hope that I work well with my staff team, but also with the children and their families that I meet. So, the social worker role. So kind of what I see the social worker role as within the team is really working kind of holistically to improving that well-being for the children, for their families, from that point of diagnosis throughout their journey within the children health services. I work very closely with other members of the team, and I would say that I am then that primary point of contact for kind of practical and also social care issues. We know that long-term medical conditions impact the child and their family. This can be emotional, so that could be for parents, carers, worrying about their child's condition, what the future might look like for them. For the child, that could be anxiety and worry about procedures. That could be feeling worried about, missing school, or also what might, dialysis or transplant, look for them. We know that there's a huge impact on family life. We know that there's additional caring responsibilities. There can be an impact on parents and carers' employment, which in turn can have an impact financially for the family. For the child, as I've touched on, that could be, friendships, that could be their school attendance is then impacted there for them. So it's really things that we are thinking about within our team, and myself as part of the psychosocial team is looking at and considering with the work that I'm doing with the families. So kind of the support that myself and the psychosocial team offer is at key points through that child or young person's journey, but also it could be at non-specific times as well. So it could be at the point of diagnosis, change of treatment, so that could be dialysis, medications, thinking about transplant. That could be also at times of distress or stress that the family are experiencing, and also transition. And we think about that as a team, not just about that young person moving to adults, but also how that impacts on their carer as well. So here is just some things that I do kind of within my role. We have pre-transplant clinics that I'm very much involved in, and I'll talk a little bit more about those in another slide's time. Initial assessments are kind of holistic assessments, so those will be done with one of my nursing colleagues, and that's when it could be a family is new to us, so we will go out and visit them in their home. And we like doing that away from the hospital setting. It can feel much more kind of relaxed. I do lots of advocacy and signposting. If we do have a child who is on a child protection plan, that I will represent the team at those meetings. And then for lots of our children and young people, they may not have any social care involvement, but actually they could be having difficulties at school, for instance. And so we have team around the child meetings that I will chair those, I will help organise those, and really, again, looking at our other partner agencies that we're working with. So really thinking about the child in the centre and then everything around them. Benefit support, looking at grants, so really thinking about the financial, impacts that the family could be experiencing. Immigration support, discharge planning meeting. Quite often those are only done if it's quite a complex patient, or sometimes if it's a newborn, and then we will be linking in with health visitors. And as I mentioned earlier, we're covering the whole of the Southwest, so actually some of that work around discharge is really linking in with their local team, because they won't always be being seen up in Bristol. Liaising with other services and agencies, referrals to the local authority, and a big chunk of my time is actually providing a listening ear. That's for parents and carers, as well as children and young people as well. So this is just kind of like a typical week, really, for me. I would say I put it down at the bottom, which is the admin, but I feel like sometimes the admin is one of the biggest things that I'm doing throughout the week, although that's probably the bit I hate the most. What I really do enjoy the most is actually seeing our patients and their families face to face, ideally. So that might be on the ward, within the hemodialysis unit, or it could be within, doing the home visits. A lot of our team around the child meetings that we do, which we call TAC meetings, we do a lot of those online. Before the pandemic, we did most of those face to face. However, we didn't always get great attendance from our kind of partner agencies, again, thinking about where we're based and the areas we could be covering. So actually a positive of the pandemic was actually switching a lot of those meetings to online, and now the attendance that we get from schools, from the child's local healthcare team is brilliant, and I do think that has had a real positive impact on the care that our patients are receiving. Our integrated care meeting that we have is where we have a bit of a rolling programme, and we have 7 consultants, paediatric consultants within Bristol, and it's on a rolling programme, and once a week one of those consultants will come and they will discuss cases with myself, our psychologist, our play team, our dietitians and our nurses, and we'll be very much looking at what's happening for this child, this family at the moment. Is there anything that we need to be doing? So yeah, and like I said, rolling programme there. So each week is always one of the consultants. And we also have our multidisciplinary meeting where we're talking about our inpatients and our dialysis patients. But this just allows us to be thinking much more, again, holistically about the needs of the child and the family. So just a couple of pictures here of some of what I do. Although I did say that I do a lot of admin, I do lots of other really interesting and fun things as well. I've been to conferences, so quite similar to today. And I help run a Young People's Day, which we do that once a year in the October half term, so we have another one coming up. And that's an opportunity for our young people to meet other young people that they never really get to see within our clinic kind of environment. We do a lot of there around transition, so really supporting the young person with what's going to happen next. We do a camp once a year, and this is a fantastic opportunity for us to see our patients outside of the hospital environment. I would say camp is probably one of my favourite things that I do throughout the year. We do just lots of really fun activities like kayaking and climbing. Some of our young people have actually never met another young person with a transplant or who's on dialysis before. Camp doesn't stop them from coming if they are on dialysis. We make it work. We've taken patients on PD before, we've taken patients on hemo. Because we only go for a couple of days, we can make that work with their dialysis, for their hemodialysis schedule. A couple of years ago, we had a group of young people, and in the evening, they get a bit of free time. And me and my nursing colleagues were kind of sat in the kitchen. Then my nursing colleagues were just sorting out meds and things, and we could hear our young people, and they were all sharing their stories and showing their transplant scars to each other. And it actually just, I felt really emotional with that, and it was really lovely because I meant lots of them have never met anybody, within their school, within their social environment. So, it made me just again go, this is why we do camp, and this is why it does mean so much for them. I also do some support within clinic, so that could be just checking in with families to see how they are, is there anything they need, but also do some support around blood tests as well, if that is what a child or a young person needs. So what does psychosocial care look like in Bristol? My notes here are actually really small for this section, so I can't actually read it very well, so I'm just going to do a bit of a turn. But hopefully you can all see those there. But our aim is to integrate so a holistic approach within the paediatric, the kidney care. Our team is psychologists, myself as a social worker, and we have specialist play workers. As I mentioned, some of our meetings, so we're very much involved with those. We also do support, so direct or indirect assessment and intervention, and that can be on inpatient wards, that could be outpatients, and also within the community. We have an active role in developing our care pathways. We do networking and developing with our partner agencies, attending those meetings, and really think about promoting good safeguarding practices too. So The psychosocial joint working, I've touched on many of these throughout the previous kind of slides. Lots of my work that I do is with my colleagues. There's probably not much that I do kind of, on my own. A couple of the new kind of projects that we've been running the last couple of years is our parent wellbeing group. And also we are running some sessions that we call Supporting Your Child. Both of those are for parents and carers. Supporting Your Child sessions have a focus. And I would say our most popular ones that we do are around transition, feeding and eating, and transplant. And we see those as a rolling programme. The next couple of slides, I'll just show you how our joint working is demonstrated within a child's transplant journey. Some of the quotes here are from before my time as a social worker within the team, but where the pathway was developed. So this in the next slide, hopefully you'll see some of that, the joint working and some of where the psychosocial team fits in within our pathway. So there's lots of our patients who I might not know, and that's because their kidney function is above 30. Or much higher, but they're under the consultants for kind of monitoring. When that gets to that point, if I don't know them already, I will be introduced to them, and my psychosocial colleagues also will be introduced to that child and that family, and we will do some a kind of assessment at that point. We will then be looking at the preparation. So our nurses will be doing that medical preparation, and then our play psychology will be looking at what preparation does the child need at that point. And then it continues into our pre-transplant clinic. So we're very much guided by our consultant nephrologists at that point. They will refer into our transplant clinic, and we have a pre-assessment appointment. Those are all online now. They have been since the pandemic. And the pre-transplant clinic, the child and their parents' carers will have 45 minutes with a consultant and one of our clinical nurse specialists, and they will talk about transplant. They will talk about risks going through the process. After that, they will then have 45 minutes with myself and my colleague, Ros, who's a psychologist, and we are then very much looking at finding out a bit more about the family, if it's a fairly new family to us, thinking about how is transplant going to look, for you. So what we call the family plan. Sometimes families come to us and they haven't really thought about how logistically it might work. In paediatrics, you're looking at up to 10 to 14 days inpatient stay, and sometimes there's families that say haven't even thought about what that might look like for the other children in the family or the pets that we have and those kind of things. So it's a real good opportunity there to talk about that with them. And we'll also be wanting to find out much more about the child and how we can be supporting them through that process as well. And sometimes from that clinic, there are actions that we take from that. So that might be some psychological support. It might be linking with the child's school, that kind of thing. And then a month later, they then come to an in-person clinic appointment, which is with the surgeon and also one of our consultants. I'm kind of present, not within the room, but I'm there within the outpatient clinic. Some of our families have never been to the Children's Hospital in Bristol before. So one of the things I will be doing at that point is taking them round, showing them the ward where their child will be, talking a little bit about the area. I kind of really feel that how terrifying that must be, actually, when you've never been to an area before, never been to a hospital, and all of a sudden this, really significant life event's going to be happening. So trying to support with that process where possible. Also in Bristol, we do the transplants for the South Wales patients who are looked after in Cardiff's paediatric team. So again, we'll have lots of families from Wales who have never been to Bristol and never been to our hospital before. So some of the shared roles, I've talked a little bit about the team around the child meetings that we have, and then the pre-transplant clinic and our planning that we do. But just an example on the left of your screen is one of our dialysis patients who was going to be having a transplant. School and parents had reached out to us and said, he was only 5, he's really struggling, we could really do with some support here. So as a team, we all got together with school, with parents, and then we developed a plan on how they could support with the distress that he was showing. So during transplant, we make a plan when they come to pre-transplant clinic. So during transplant, reviewing that plan can actually be really helpful. And that's really around the fact that actually it can be really challenging to access the coping mechanisms that we have in times of high stress. So looking at our plan can really act as a prompt and a reminder for the family. We're thinking about their general needs, so kind of social support, community, breaks, time outside the hospital, and ensuring that they're looking after themselves, eating and drinking and things. I think we've recognised and have found that if parents and carers feel safe and supported, then actually it supports them in being able to care for their child at that time. After transplant, we're very much thinking about the adjustment to life outside of the hospital. For parents and carers, it can be really thinking about re-establishing their identity. One of the common things that parents say to us, particularly if their child has been on peritoneal dialysis, is saying, I don't know what my role is anymore. We don't do dialysis now. Who am I? So we do spend some time thinking about that for them and what are their hopes and dreams and what would they like to be doing kind of next. We offer them our parent wellbeing group that they can access, or for some parents and carers, one-to-one support might be preferable. And then the diagram just in the middle, which says port choices, is around, we had one patient who, after her hemodialysis line was out, she then had a port, and she was really struggling kind of with that being accessed. So it was looking at a plan so she was feeling that she had some control and choice within that. So here's just a quote from one of our parents, and this was really around looking at, I guess for us, how we then see that the individualised approach for transplant and the benefits that the family, felt from that. There was input from myself, the play specialist, psychologist, music therapist, and for this child, they really loved Sonic and Mario. So their preparation was actually really tailored around Sonic and Mario. So Sonic and Mario went on a kidney quest. And so this child had a book that was his prep book, talking all about what happens in transplant. And since he had his transplant, Sonic and Mario have now been on a blood test quest. And he's really like that. And this child has collected gems that he's got for each thing that he did. And so a blood test was a big thing. He really wanted his hemodialysis line out. We're nearly at that point, which is really great. But it's been a really long journey with lots of input from everybody. So one of the other things as well is transition. So Psychosocial team is very involved in transition, and some of you may know the Ready, Steady, Go programme, and we follow that. We do additional things within that I've mentioned, Young People's Day, camp. We also might have complex case meetings for some young people, and also some one-to-one mentoring. I'm very quickly running out of time. No two transitions are the same, and we work really hard to support our young people and consider all of their needs and think about them in the wider context. And here's just a diagram here explaining that. So I didn't think I would... Oh, it doesn't come up anyway. Okay, no? Oh, that's fine. I was thinking there might be a little video clip that I could show, which is talking about the adolescent brain. It's fine. I don't have time anyway. It's all right. No worries. But she's actually called Sarah Jane Blakemore. So if you looked on YouTube, and it's a TED Talk, have a little look. It's really interesting. Thank you very much.